Welcome to Let's Talk Space Medicine. I'm Kyle Anderson, your medical student slash space nerd host. For your listening entertainment, I gather my other medically inclined space nerd friends to talk all things space medicine. With our powers combined, we hope to explore and entertain the medical questions that stand between us and the stars. Today's episode: the contraceptive pill and bone health. Two birds with one stone? During this episode, I worked with my space nerd friends Aurora, Avinash, and Ben from the Nexus Aurora Discord community to try and answer the question: can the oral contraceptive pill serve a multifunctional role in both inducing amenorrhea while also preserving bone health in female astronauts? As a brief disclaimer, anything discussed on Let's Talk Space Medicine should not be considered medical advice, and is therefore not a substitute for seeking medical help from a doctor. We are simply interested at entertaining topics in the field of space medicine. Today's episode begins with a fictional case study where a 42-year-old female presents to your clinic with a desire to control her menstrual cycles for work reasons. The patient states that her desire for amenorrhea is simply out of convenience and is better suited for her job environment that she will be entering for the next 6 months to 2-year period. When you question further, her job environment is described as both dangerous and may cause other issues like bone loss. Vitals and past medical history reveal a very healthy person with no significant medical history that you should be concerned about. Upon review of systems, the only positive finding is some irregularity in menstruation. So you might have guessed, this is a fictional case study based off of a real NASA astronaut who's about to go to the International Space Station. This fictional case was modeled off of Dr. Kathleen Rubins, a microbiologist and NASA astronaut who is currently living aboard the International Space Station. I chose to model it off of this person because a similar situation may have occurred before flight when meeting with their flight surgeon, who would have to both consider what form of contraception would be chosen and the best medication for her bone health. So, your goals as a flight surgeon are to provide a regimen that accomplishes 1. Contraception, 2. Reduction of menstrual symptoms, and 3. Promotion of bone health for these long-duration space missions. As a brief background, pregnancy is actually contraindicated in spaceflight, and this is likely due to the fact that microgravity is potentially teratogenic, meaning it could negatively affect the development of the baby and most likely the health of the mother in a serious way. On top of this, the mother and baby would be very far from any beneficial prenatal supplements or basic obstetric care. Therefore, both the environment and lack of medical care make pregnancy not advisable during spaceflight. It is interesting, though. If we were to one day truly have a self-sustaining moon or Martian colony, we will have to figure this out and really solve how to make pregnancy safe in these conditions. One question that comes to mind: what level of medical evidence will we need to consider it safe to condone conceiving the very first pregnancy off of Earth? While this is certainly an interesting question, to the best of my knowledge, there has been no occurrence of either conception or pregnancy in space. And female astronauts generally opt for the oral contraceptive pill simply for controlling menstrual cycles rather than for birth control reasons. Importantly, other methods of menstrual control exist, such as a subdermal injection as well as intrauterine devices. And we hope to compare these in terms of bone health, which we know is negatively affected in spaceflight as well. In one study comparing premenopausal women aged 18 to 33 years old that were given a variety of formulations of hormonal contraception, it was determined that subjects giving subdermal injection as a depot had significantly reduced bone mineral density as compared to controls. On the other hand, Another set of subjects were given oral contraception in pill form and demonstrated no negative effect, which suggests that the pill form may be more favorable to injection in terms of bone health. The lack of any positive effects by either injection or by pill is actually quite plausible. Contraceptive medications contain synthetic estrogens and progestins that cause a series of negative feedbacks at the hypothalamus and pituitary that can end result in a reduction in endogenous sex hormones. This cascade of effects can result in contraceptive pills actually impacting the level of circulating estrogen in a negative way, which we know has a well-described effect on bone tissue. It is important to note that this study was performed in premenopausal women, which also may not reflect the average age of a female astronaut. Another study performed a systematic review of oral contraceptive use and bone, and this study compared a number of different studies with a wider range of subject age. Interestingly, as the subject age increased, the oral contraceptive pill trended towards a more positive effect, including decreased bone turnover markers and increased BMD at skeletal sites like the femoral neck and spine. This observation could be attributed to the fact that as women approach menopause, they're already at a lower level of circulating estrogens and progestins. So, when you therefore take the oral contraceptive pill, you are replacing these sex hormones that could have a positive effect on bone. So it seems that the oral contraceptive pill is favorable as age increases, and this may align well with the age of a woman who's entering the astronaut corps. However, supply of the oral contraceptive pill, as well as keeping a dosing schedule during a prolonged space mission, may make something like an IUD more suitable. In a study using subjects aged 40 to 43 years old, comparing a hormonally based IUD compared to a copper-based IUD, there appears to be no negative effect on BMD. So, while there was no difference found in this study, it is possible that a study in older populations may see a greater benefit on BMD, as was found in studies using the contraceptive pill. In addition, there may be a significant occupational benefit for flight surgeons to consider by not having to supply pills and maintain a dosing schedule during a space mission. All these things considered, it may be possible that a oral contraceptive pill as well as a hormone-based IUD may be combined for the best option for flight surgeons to both effectively induce amenorrhea and preserve bone health in female astronauts. But this conclusion rests on many gaps in knowledge that are limited by the studies that we have at our disposal. Some of these limitations include the fact that there are no known studies to my knowledge of oral contraceptive pill use in a spaceflight analog such as bed rest. It would be interesting to note whether or not the drug works similarly in a case of chronic disuse that this model provides. In addition to that, it'd be really nice to know extra measures besides just BMD and circulating markers and bone health. Bone health is much more complicated than just those two measures, so it'd be nice to have. On top of that, it'd be even better if we could study this in actual spaceflight conditions, but there are limitations to doing that as well. So, what do you think? Does supply of the oral contraceptive pill make an IUD a better choice? Can they be combined? Or do the added risks of an IUD and potential difficulty of removal make one reconsider that? Thanks for listening to Let's Talk Space Medicine. If you want to continue the discussion and meet more fellow space nerds, be sure to check out @TalkSpaceMed on Twitter and the Nexus Aurora server on Discord. Thanks, and see you next episode.